Depression or major depressive disorder is a mental health condition marked by an overwhelming feeling of sadness, isolation, and despair that affects how a person thinks, feels, and functions. The condition may significantly interface with a person's daily life and may prompt thoughts of suicide. Depression isn't the same as sadness, loneliness, or grief caused by a challenging life experience such as death of a loved one. In 2015, an estimated 16.1 million US adults aged 18 or older, or 6 to 7% of the adult population, had at least one major depressive episode or experienced depressive symptoms in the past year, making this condition one of the most common mental disorders in the United States, according to the National Institute of Mental Health. Depression can affect people of all ages, races, and socioeconomic classes, and can strike at any time. The condition is found in twice as many women as men. In a recently published report from the Centers of Disease Control and Prevention, researchers found that women between 40 to 59 have the highest rate of depression, 12 to 3% of any group based on age and gender in the United States. People with depression may experience a variety of symptoms, but mostly commonly a deep feeling of sadness or marked loss of interest or pleasure in daily activities. According to the American Psychiatric Association, other symptoms of depression may include irritability, agitation or restlessness, lower sex drive, inability to focus, concentrate or make decisions, insomnia or sleeping too much, change in appetite and or weight, eating too much or too little, tiredness and lack of energy, unexplainable crying spells, unexplainable physical symptoms such as headaches or body aches, feeling hopeless or worthless, withdrawal from social situations and normal activities, thoughts of death or suicide. The causes of depression are not fully understood, but scientists think that an imbalance in the brain's signaling chemicals may be responsible for the conditions in many patients. However, there are several theories about what this imbalance actually is and which signaling chemicals are involved. Moreover, a variety of distressing life situations are also associated, including early childhood trauma, a job loss, the death of a loved one, financial troubles, or a divorce. Most likely, depression is caused by a combination of genetic, biological, environmental, and psychological factors. Certain medical conditions may also trigger depression, including an underactive thyroid gland, cancer, heart disease, prolonged pain, and other significant illness. Hormonal-induced depression can arise after childbirth or at menopause as well. Additionally, some sedatives such as sleeping pills and high blood pressure medications are linked to depression. Surveys have showed that up to half of Nigerians with depression don't get medical help for their condition. Left untreated, major depression can set off a chain of social, emotional, and health consequences that add to patients' overall stress. According to the Mayo Clinic, this includes alcohol or drug abuse, anxiety, social isolation, and relationship conflicts, work or social difficulties, or suicide. Depression treatment may involve psychotherapy, medications, or a combination of the two. Prescription drugs called antidepressants help alter mood by affecting naturally occurring brain chemicals. There are several categories of antidepressants, but doctors often start with a class of drugs called selective serotonin reuptake inhibitors and may try other medications if the patient's condition don't improve. Psychotherapy, also known as talk therapy or counseling. This treatment has been shown to help patients with depression. Several studies have suggested that combining psychotherapy and medication together works best for treating people with severe depression. Different types of psychotherapy include cognitive behavioral therapy, which helps a person change negative thought patterns and replace them with healthier ones, as well as interpersonal therapy, which is designed to help someone understand and work through difficult relationships. According to the National Institute of Mental Health, another form of psychotherapy is problem-solving therapy, which involves coming up with realistic solutions to cope with stressful situations. For patients with severe depression who have not responded to any medications or psychotherapy, doctors may consider transcranial magnetic stimulation. According to the Mayo Clinic, TMS involves reviving brief magnetic pulses on the scalp to stimulate nerve cells in the brain that are thought to be involved in mood regulation and depression. For more information about depression, please follow at Health and Homes across all social media platforms.